Hi everyone, and welcome to the Chapter 7 lecture for medical terminology. Chapter 7 is all about dermatology, or the study of the integumentary system. So integument means, integuo means to cover. So the integument refers to the skin, which covers our body. The skin also includes other components like sweat glands, sebaceous glands, hair, and also nails are part of the integumentary system. So there's a lot of parts, and this is a little bit of a longer chapter. The purpose of the integumentary system is to cover our bodies. It's to provide insulating function to keep water in, and also to protect our insides from invasion, from pathogens. So it's sort of it's a protective barrier. So I have two words of the day this chapter. The first one is hypertrichosis, which is a condition that's also sometimes called werewolf syndrome. So you do actually have hair all over your body, except for on the palms of your hands and the soles of your feet. But the hair on most of our bodies is very fine. It's like the hair on your face is very fine. But some people have this condition where they are producing these thick hairs throughout their body, all over their body. So they become covered in thick hair, and that's hypertrichosis. So it can be congenital condition that you're born with, or it can be acquired, but it is not hormone dependent. So it's an androgen independent type of hairiness. So we'll talk about hirsutism, which is excessive hairiness due to excess androgen production like testosterone, which stimulates hair growth. But this is actually an issue with the follicles producing the wrong type of hair. So hyper means excessive, tricho is a combining form for hair, and osis, of course, is a condition. I think it's fun. I like actually presenting words of the day that have to do with conditions or medical conditions. If you're posting in the forum and you're picking medical conditions, I always find it interesting to find ones that potentially could have been the source of some kind of science fiction creature or character, because it's very possible that the whole myth of werewolves may have started with someone who had hypertrichosis and was mistaken for some kind of mythical creature, or advertised like, through like circus performing or something. But a lot of times are really just people who have these rare conditions. So while the condition is, I think, recessive, not very common, it does still exist in the modern world, but we have treatments and therapies for it, so you typically wouldn't see someone displaying it. Now, another interesting word of the day is trichobezoar, which is basically the medical term for a hairball, a very large hairball. So tricho, again, means hair, and bezoar is a mass that's trapped in the gut. So bezoar, I think, is, if you look it up, I think it says something about a stone in a goat's gut or something like that. But this is a picture of a particularly large trichobezoar or hairball. So this in some animals, that like cats that lick themselves, it's normal for them to have hairballs and to cough them up. Humans, not so much, but there are some people that have sort of comorbidities with certain psychological conditions or anxiety conditions. They chew on their hair. It's called trichophagia. So to sort of chew on your hair, you end up swallowing it, and hair is not digestible. The protein is very stable, and it tends to knot and get stuck in the stomach and not pass into the intestines. And so then you get this massive knot of hair in the shape of the stomach, and this tail here is the part that was actually extending into the small intestine. So this can cause a significant blockage and has to be surgically removed. So this one in particular is called Rapunzel syndrome, when you have a very large trichobezoar that actually has a ponytail, if you will, a tail. It's called Rapunzel syndrome. So some kind of funny terms of the day there. All right, so now let's talk about the integumentary system. We'll start with the skin. the main part of it. So the skin is divided into two layers. There's the epidermis. Epi means upon or above, so it's the top layer, and it's very thin compared to the dermis, which is very thick underneath. So the epidermis is made up of epithelial tissue, which means cells on top. And it's thin, but there are several layers of cells there. The dermis is where you actually have all of the blood vessels and the muscles and the nerves and the sweat glands and sebaceous glands and hair follicles. All the good stuff is in the dermis. The epidermis actually has no vasculature or nerve sensation. So if you ever you can stick like a needle through your skin, just the surface layers, you can stick it through the epidermis without it hurting or bleeding because there's no blood vessels there. So this epidermis is really a good shield layer. We'll see that it's made up, there's a lot of dead cell layers that just help to prevent things from getting in to deeper layers of the body. So the epidermis is made up of several layers. The bottom layer is called the basal layer or the basement membrane. And these are where the sort of skin stem cells are. So these cells can produce more skin cells. And then those skin cells sort of mature and grow up into the layers here. So these cells here are called keratinocytes. And the keratinocytes, their job is to make keratin, which is a protein. It's the same protein that your nails and your hair are made out of. And they make more and more keratin as they grow up in this layer until they become so full of keratin that they basically die. And so in this pink layer up here, the cells are actually dying, and they basically just become empty packets of keratin, these dead packets of keratin, and that's the stratum corneum up here, just layers of dead skin cells that can slough off. We call that exfoliation. Folio as in foliage, like a leaf. So these cells just flake off like leaves. So you're constantly shedding dead skin cells and making new ones from this basement layer. And it's these basal cells that sometimes can go awry in their reproduction and become cancerous. Another type of cell that can become cancerous in the skin, that's important in the skin, and is in that basement membrane are the melanocytes. This one that looks kind of like a deer with antlers here and has these little dark spots in it and is releasing those little dark spots into the keratinocytes. So those little dark things are dark pigments called melanin. Melano means dark or black, so it's a substance that's black, and its purpose is to absorb UV light, actually. So UV light can damage your DNA. And since it doesn't penetrate very far, it penetrates into the skin, but it doesn't penetrate much farther than that. So it's really your skin that needs protection from UV light, your skin cells that can be mutated by that UV light. And melanin sort of absorbs that UV radiation and protects your DNA, which is why your skin becomes darker when you spend time in the sun, because it increases your melanin production. But we also all sort of have a genetically set amount of sort of baseline melanin production, which is why we have different skin colors, is due to different amounts of baseline melanin production. So that's what I wanted to say about the epidermis. The dermis is that much thicker layer beneath the epidermis. It contains arteries and veins in red and blue here. The nerves, which are kind of like this whitish, yellowish vessel that you see. We've got hair follicles where the hairs are generated, sebaceous glands, which are connected to the hair follicles, and the sweat glands, which secrete fluids and electrolytes and help us to cool off when we are hot. All this pink tissue is not muscle. It's type of connective tissue. It contains a lot of collagen. It contains a lot of proteins, but two important proteins in the dermis are collagen and elastin. Collagen helps give your skin firmness, and elastin makes it stretchy but also be able to come back after stretching out. And so we lose that elasticity because we produce less elastin as we get older, which is why the skin wrinkles. And so as young people have a lot more of that elastin than older people do. So these glands, the sebaceous glands and the sweat glands that are found in the dermis, are what we call exocrine glands. So there's endocrine and exocrine glands. Glands are anything that secrete stuff. The endocrine glands are the topic of chapter 14, which we won't get to this semester. And they are glands that secrete substances within the body. Endo means within. And exocrine glands secrete stuff out of the body. Exo means outside. So the sebaceous glands secrete oil, or the medical term for it is sebum, which is like oil and dead skin cells. They're connected to the hair follicle, so they do help to lubricate the hair and also the skin, the outer parts of the skin, but they also, a lot of microbiology research is starting to show that the oil is actually food for good microbes that live on the surface of our skin that we want to sort of cultivate to help keep us healthy and prevent pathogens from invading the skin. The sweat glands are also known as the sudoriferous glands, sudorifero meaning sweat. And the purpose of them is really in temperature regulation. Sweat helps our body cool down quickly when we overheat, when we're exercising, or when it's hot out, because of the evaporative cooling of water leaving the skin. The dermatome actually has two meanings. Dermatome can be a tool used to cut. Dermatome, tome is to cut. But it, more importantly, it is a division of the skin and some of the underlying organs and muscles and stuff into these regions that are innervated by certain parts of the nervous system. So as you go down the spinal cord, there are spinal nerves that radiate off in a horizontal way. And so if you were to damage your spinal cord at one of these points, everything below that point could be potentially affected, including these regions of the skin. It's also something that comes into play when we talk about a skin disease called shingles. Shingles is an infection. It infects the nervous system. It affects the skin, and then it can hide in the nerve cells and then re-emerge. And when it re-emerges, it typically breaks out along one of these dermatomes, one of these sort of skin patches that are basically innervated by specific nerves. Hair is another component of the integumentary system. Hair is just a protein. It's just protein, so it's not living tissue. Hair is not made of cells. It is just proteins, but they are made by cells in the hair follicle down here. So the hair follicle generates these proteins, and they grow and grow and grow. The purpose of the hair is to help insulate the body and keep heat in. Humans are we are fairly less hairy mammals. We've evolved to only have really thick hair covering parts of our bodies, but nonetheless, it does help to keep insulating it. The hair is colored by the same thing your skin is colored by, these pigments, these melanin pigments. And it's made of the same protein as your nails and your skin, keratin. That's protein keratin. Fun fact, goosebumps are when your hair follicles contract in an effort to retain heat. So you get goosebumps when you're cold as a way to try to retain heat. You also get goosebumps though when you're scared, or when you have that sensation like something's creeping you out. So there's a thought, evolutionary biologists think that that's because in at least fur-covered mammals, when they are scared, let's say a cat, if it's scared, it's probably scared of a predator or a potential predator. So when it gets goosebumps, when its hairs stand on end, it makes the cat look bigger and more frightening. So that goosebumps as a response to fear may actually be an evolutionary adaptation to make you look bigger. Doesn't really work so much for humans, but the medical term for goosebumps is piloerection. Pilo is another combining form for hair, and erect means to stand up straight. So your hairs stand up straight. Piloerection. The nails are also part of the integumentary system. So we can see all the parts of the nail here. The nail itself is just made of protein. It's not living. It doesn't have nerve cells. It doesn't have blood vessels going to it. So you can cut your nails just like you cut your hair. It's painless, all right? But underneath the nail here is the nail bed, which is a very sensitive area of skin, highly innervated, and there's lots of blood vessels. So if you get something jammed in there in your nail, it hurts pretty bad. Or if you like shut your nail in a door, it hurts pretty bad. The nail itself comes from cells down here in the nail root. So these are cells kind of like the hair follicle makes the hairs. The nail root cells make the nail. If you've ever lost a nail due to trauma, you'll see that it grows back from this little, from the bottom up. And that's because the nail root's producing the nail. The top part of the nail root is visible in a lot of nails, and that's called the lunula. That little crescent moon shape is actually part of the nail root that's visible. And lastly, the skin around the sides of the nail is called the cuticle, and there's often a buildup of dead skin cells there, and they're just there to sort of seal off that opening between the nail root or the nail bed and the nail. A lot of times if you go get your nails done at like a salon, they will remove that cuticle because it looks nicer, but it can actually make you more prone to infections because then bacteria can get into the cuticle. Subcutaneous tissue underneath the dermis, if I just go back for a second. All right, here's the dermis. Underneath the dermis, we see this fatty tissue down here. These yellow bubbles are fat, adipose tissue. This is the subcutaneous layer. It's technically not part of the skin. It's part of the connective tissue, but I mention it here just because it's sort of connected to the skin. And it's full of adipose tissue. Adipose tissue are fat-storing cells. And it's there for cushioning, for insulation, it stores energy. So there's a lot of purposes for that subcutaneous tissue. Now the skin and elements of the integumentary system play a big role in forensics. So I have this little slide to highlight that. So first and foremost, the start of forensics, the first piece of evidence in forensics was the fingerprint. People recognizing that fingerprints were unique amongst individuals and could be used to identify individuals like criminals and fingerprints at a crime scene. So everyone has a totally unique set of fingerprints, even twins who are identical, who have the same exact DNA, will have different fingerprints. So they are a unique identifying feature. You have probably also heard of cases of people's hairs being used to identify them as suspects. It's not the hair itself. So if you went to a hair salon and collected hair off the floor that had been cut, you probably wouldn't find much DNA there at all. The hair that contains DNA are hairs that are actually plucked from the scalp and that have a little plug at the end of hair follicle cells. So only hairs that contain follicle cells from the hair follicle can actually be used to find DNA. So there may be hair at the scene, there may or may not be DNA on those hairs. Another thing of the integumentary system that can be used in forensics is the fingernails. So some poisons, like arsenic, causes a distinctive banding pattern on the fingernails that can help determine cause of death due to arsenic poisoning. And this last one is kind of a weird esoteric one. But if a body is buried in basic dirt, so it has a high pH, it can actually turn fat into soap. And it's called grave wax is the sort of common term, but the medical term is adipocere. And I have to mention it here because I used to live in Philadelphia, and this is a picture from a famous museum in Philadelphia called the Mutter Museum, or Mutter, I don't know how to say it, I think it's a German name. M-U-T-T-E-R, but the U is like an umlaut. Anyway, it's a collection of medical oddities that this one doctor kind of put together, I think in the late 1800s, early 1900s. And one of the things on display there is actually a human body, a female, who her and her husband were actually buried together, not in coffins, just in the dirt. And they both were overweight, had a lot of fat, subcutaneous tissue, and their fat reacted with the soil and turned into soap, and it actually preserved their bodies quite well. And so this body is actually on display at this museum, and I think the title of the display is Soap Lady. And I think her husband's body is in a museum in the UK somewhere. I'll refer to the Mutter Museum a few times. If you ever go to Philly, you should check it out. It's very interesting. Allergies. I don't know why this is not covered in the chapter on the immune system, because allergies are actually an immune response, but they often manifest as skin reactions, so I guess they decided to put it in this chapter. This is my kitty. She really wants some love right now. Luckily, I am not allergic to her, or I might be showing some of these signs, like erythema, redness, or edema, which is the medical word for swelling, when a tissue fills with fluid and gets swollen, and pruritus. Pruritus means itching. It's the medical word for itching. Notice the spelling of pruritus. It's I-T-U-S, even though you say it kind of like I-T-I-S. But remember, I-T-I-S, itis is infection or inflammation, and itching is something different, so it has a different ending spelling, pruritus. So allergic reactions are basically, they are hyperreactions of the immune system when you are hypersensitive to harmless things like pollen or mosquito spit, and your body gets inflamed as a reaction. So you can have a local allergic reaction, which is just like when you get a bug bite and it swells at the site and it's itchy and it's red and it's swollen. Or you can have a systemic, body-wide type of reaction, and we call that anaphylaxis. And anaphylaxis is basically so the cells that govern these allergic reactions are those basophils. And these blue granules here contain a number of chemicals, but one important one is histamine. And histamine is what contributes to the redness and the swelling and the itching. And so in a local reaction, you have local histamine release, but in anaphylaxis, you have systemic histamine release. So it causes basically massive inflammation throughout your blood vessels. All right, so now for some other diseases and conditions of the integumentary system. So the first one is dermatitis, which is just inflammation of the skin or irritation of the skin even. So your skin can become inflamed if you wear, clothes that just chafe against your body and cause it to be itchy and red, maybe a little bit of a raised rash. All right, that's dermatitis. And xeroderma is dry skin. So when your skin gets kind of itchy and flaky, the term for that is xeroderma. Zero means dry. Xerox machines, the copier, is named after that because they were the first company to use dry ink in a photocopier. So that's where Xerox got its name as well. Edema is swelling, the medical term for swelling, and what's shown in this picture here is an example of pitting edema, when you have You can have edema from inflammation, like if you have an infection or if you have a broken ankle and your foot is swollen, that edema tends to be sort of more firm and painful. But if you're just retaining fluids, like when you're pregnant and you have swelling feet, all right, it's very typical to see this sort of pitting edema. And so when I've been pregnant, I've had this, and my kids have always had a fun time doing this little activity of putting a finger on my foot, and then they remove it, and you see there's like this little pit there that takes a minute to fill back up. So that's fluid retention edema. Hemorrhaging in the skin. That's a bruise is basically just bleeding in the skin, broken blood vessels in the skin. So there's different types of bruises, if you will. The medical term for bruises are contusions. So this right here would be a large contusion. I think I got this from Google, somebody who like fell skateboarding or snowboarding and has this giant contusion. There's also very small types of hemorrhages of bruising. Petechia are what's pictured here. It almost looks like a rash. It's kind of like actually what you see like if you have a hickey. It's lots of small broken blood vessels. And it can also be, if you experience these like in patches around the body, these can be signs of disease. Some diseases that can cause bleeding or breaking of blood vessels can lead to petechiae. So these are often not often, I mean, they can be from some types of trauma, but a lot of times they're from some underlying disease. But a large bruise like this, a contusion, would be called this would be called an ecchymosis. So ecchymosis is singular, ecchymoses is plural. And then a hematoma is a tumor or mass of blood. Otherwise, what we would call a blood blister. So sometimes you might get these on your feet. If you have shoes that chafe, you might get a blood blister, or if you get pinched really hard on your hand or something, you might develop a hematoma, a blood blister. The bad types of hematomas are ones that form inside the body. They can rupture. So we'll talk about a subdural hematoma in the next chapter, which can happen in the brain. Here's one, a subungual hematoma. Unguo is a combining form for nail. So if you shut your nail in a car door, you may develop a blood blister underneath it, a hematoma. And a lot of times that ends up causing the nail to fall off so it can fully heal. Some other diseases and conditions, different types of lesions that you can have on the skin. So a lot of these are lesions that you will see in acne. So the cyst form of acne is fluid-filled, oil-filled raised bumps versus pustules, which contain pus from dead neutrophils. You can have raised bumps from bug bites. So things like these wheals, these are raised itchy bumps that you get from bug bites, or if you have an allergic reaction and you develop hives to something. You can have different types of skin markings like freckles and age spots, and these are called macules. So flat, discolored spots are called macules. You can have breaks in the skin, like if it gets dry and cracked, like in the winter time, like the sides of your lips, or sometimes I get like cracks in the, I don't know, this part between my thumb and forefinger skin. And those are called fissures, where it gets dry and it cracks. So there's different types of lesions that you can have on the skin. You can have changes in skin color. So I kind of organized them all on this slide here. Albinism, albino means white. So leuco and albino have the same meaning. Albinism is a genetic condition that is a lack of melanin production. So people with true albinism, they don't make melanin in their skin, in their hair. There's even some melanin pigments that color the eyes. So they have very pale skin, pale hair, and pale eyes. Cyanosis, cyano means blue. So this is a bluing of the skin that happens if you are lacking oxygen. And this picture here is supposed to be a picture of a baby with perioral cyanosis, so around the mouth, though it's kind of hard to see here. Erythema, erythro is red, so erythema is redness of the skin. Like if you have dermatitis, you may have redness, irritation. Jaundice, jondo means yellow, and this is common side effect of liver problems. A yellowing of the skin can be seen, and that is a sign of liver disease. Necrosis, necro means dead, but dead tissue usually turns black. So this is someone who has frostbitten fingers, and the frostbite led to a freezing of the tissue that led to a lack of blood flow to the tissue. And the first stage of that is pallor, so you lose color, and that's a sign of not getting blood to the tissue and getting it fed by that nice red blood. And pallor can return to a nice red-pink color. But if the tissue is starved of oxygen and blood for too long, then it will die, and dead tissue turns black and necrotic. And so this is a picture, this line right here is a marker line that the doctor drew where they're going to amputate the end of this finger, because if tissue is dead, you can't bring it back to life. You have to cut it off, so otherwise it starts to rot, and it can basically, what's the word I'm looking for? Contaminate the rest of your tissue or lead to an infection that spreads through the body. So necrotic tissue must be removed in all cases. And then vitiligo. Vitiligo is a skin condition that's actually fairly common, where it's actually an autoimmune disease where your melanin producing, so the melanocytes start being attacked basically. So you start losing that dark pigmentation in patches around your body. And so this would be the person's normal skin color, and this would be the vitiligo setting in. So losing that, the melanin. So people of all skin types can develop this autoimmune disease. One very famous person who had this disease was Michael Jackson, who there's no treatment for the disease, but he did have his skin treated so that the mottling went away, so that it was all the same color. Some skin injuries, an abrasion is like what we would call a scrape. So if you fall and scrape your knee on the sidewalk as you slid across the sidewalk or a rug, that would be an abrasion. A blister is a raised, fluid-filled type of injury that's from rubbing, a chafing injury. And a callus is sort of what's left after a blister heals. It's sort of a thickened area of the epidermis. And so if you have like a pair of shoes that the first time you wore them, they gave you blisters, but you kept wearing them, you would probably develop a callus. A lot of people, like I know I myself, have a callus I have one on my middle finger where, like from holding a pen, like I have like this permanent callus from holding writing utensils. A burn is a type of skin injury. There's different levels of burn injuries. So a very mild burn, a first-degree burn would just cause the skin to be red and, maybe warm to the touch, and it would be painful. It would sting. So like a lot of sunburns are first-degree burns, or if you just very quickly, touch something that's hot. A second-degree burn results in blistering. So it actually burns through the epidermis and into the dermis a little bit, and it leads to blistering. Third-degree burns are through the epidermis and through the dermis, so they're pretty deep and pretty serious, and oftentimes lead to these black necrotic tissue scars called eschars. And so necrotic tissue, like I said, it has to be removed, or otherwise it rots and can be a source of infection. And so necrotic tissue has to be removed, and it's particularly unpleasant in burn wounds. So part of treating burn victims is doing regular debridement or removal, peeling off of that necrotic tissue so that it doesn't get infected. A decubitus ulcer is the medical term for a bed sore. An ulcer is a sore, it's like an open wound. And decubido means to recline or lay back. So it's basically a sore from laying in bed. So bed sores can happen when you put pressure on the same area for too long. You can cut off blood flow to it. And so people who are bedridden need to be rotated or turned or moved, and their weight needs to be shifted so that they don't develop these bed sores. An excoriation is just really any surface injury. So an abrasion, a laceration, those are all types of excoriations. Remember, ex means sort of outside of, so excorio is to take the outside of the skin off. A laceration is the medical term for a cut. We usually use this for like a deep cut, not like a paper cut, but a paper cut is technically a type of laceration. But ones that are deeper are ones that are going to require stitches, and the medical term for stitches is sutures. So you would need suturing for a laceration, not for a decubitus ulcer, not for a contusion, but for a laceration, a cut. And the sutures just pull those open parts of skin back together so that they can be touching, so they can heal faster with less of a scar or a cicatrix. So the medical term for a scar is cicatrix. I haven't heard it used much myself. I don't know how commonly it's used outside of like dermatology. A sort of exaggerated form of scarring is called a keloid, and that's what's pictured here. So some people just have genetically are prone to developing these exaggerated scar tissue called a keloid. And so it's just like when they have a cut, their body heals, except they just produce an excessive amount of scar tissue. And it's difficult to treat because if you try to remove it, then the body just makes more scar tissue. So I do think that they have discovered the enzyme that's involved. And so people who are prone to keloids now, I think if they have a cut, like a cut or a surgical scar or something, that there are certain medications they can take to reduce that keloid buildup. But that's what that is. There are different types of infections of the skin. So these are some common viral skin infections. The first one is human papillomavirus, or HPV. And HPV is often talked about as a sexually transmitted disease because there are actually multiple forms of HPV that can infect different types of skin. So the types that infect the cervical skin cells and the vaginal epithelial cells, all right, they are different strains than the ones that can infect your skin and cause like warts. So if you've ever had a wart on your hand or your arm or wherever, that was HPV, but that's not the same HPV that can give you cervical cancer or anal cancer. So there's something like 60 or 70 different strains of HPV. They all infect epithelial tissue, skin, and also some of the epithelial tissue that's sort of internal, like in your mouth or in your genitals. But there are different strains that cause these different conditions. Skin warts, genital warts, and cervical cancer are all caused by different strains of HPV. So we'll come back to HPV when we're talking about the male and female reproductive system and sexually transmitted infections. Herpes virus, also sexually transmitted infection because it can infect the mucosa, the epithelial lining of the genitals, but also can infect the skin. So HSV1 typically causes cold sores, HSV2 genital herpes. Another in the herpes virus family, so it's not herpes simplex virus, like these two are herpes simplex viruses, but varicella zoster is the virus that causes chickenpox and shingles, and it is in the herpes family. So herpes viruses, their sort of claim to fame is they infect through the skin, but then they can actually infect the nerve cells through the skin in the dermis, and they travel down the nerve into the nerve ganglion where they can lie dormant for years or decades even, and then reemerge. And so that's true for cold sores. They go away and come back. And genital herpes lesions can go away and come back. And chickenpox can go away and come back. But when it comes back as a different disease. It comes back as shingles. So if you are in the generation that was lucky enough to have a chickenpox vaccine when you were a child, you don't have to worry about shingles, because being protected from varicella zoster means that you don't get chickenpox and you won't get shingles. Now, for me and people in my generation, we got the chickenpox as kids, and we were too old to get the chickenpox vaccination. We're also too young now to get the shingles vaccine. So they did make a shingles vaccine, basically the chickenpox vaccine, but it's only approved to people who are like 50 years old and older. So for those of us in our 30s who had chickenpox as a kid and don't want to have shingles, but we can't get the shingles vaccine, so we just have to cross our fingers. So shingles, chickenpox are like just little itchy bumps all over the body, and it's a respiratory infection. So you also have, potentially cough, cold. Shingles, though, is just on the skin, and it feels a lot of people say it feels like a burn injury. It's very, very painful, and it can happen on any part of the body. You can see in this picture here that there's like a patch on this person's side, on just one side. All right, this is one of the dermatomes. This is a breakout along one of the dermatomes. You can get shingles on your face. You can get it on your hands. You can get it in your mouth. I mean, you can get it anywhere. And so also where you have it can determine also how uncomfortable and painful it is. And shingles can cause significant damage to your nerves. Some people have shingles, they have it for a couple of weeks, they take some antiviral medication, it goes away, and then it's just a bad memory. But for some people, they sustain permanent nerve damage that then causes them pain for basically ever. So it's one of the important reasons why the chickenpox vaccine was developed, was to help prevent shingles, which is something that can be very painful and debilitating. And people tend to, it's more common as you age, in the elderly years, but it's not impossible to get it when you're younger. I have a sister and a stepbrother who both got shingles in their 30s. So cross your fingers, I don't get it. Verruca is a medical term for wart, which I think is funny because I grew up watching the original Willy Wonka and Charlie and the Chocolate Factory, and the character, the sort of spoiled brat character, was named Veruca Salt. And this movie was based on a book by Roald Dahl, and he's known to, give characters names that, sort of have a meaning. So Verruca is actually Latin for wart, and she was kind of a wart of a little girl. Some other skin infections, if you have a skin infection that becomes very sort of full of pus, that's called an abscess. And an abscess usually needs to be cut and drained because it's just such a pocket of infections. This can happen around like a ingrown hair, maybe, can become abscessed. Tinea is a general term for a family of fungal infections. So there's tinea capitis, which is a scalp infection. Ringworm is very common on the skin. A lot of people have it and don't realize it. Some people, it causes a discoloration, sort of like a coffee-colored set of spots or rash. It's flat, and it usually doesn't, ringworm usually doesn't even really itch or have any other side. It just looks unappealing, but it's a fungal infection that can be treated with topical fungicides. Some of these itch, so like athlete's foot, jock itch, can cause an itching or burning sensation. And it's just a topical skin invasion of or overgrowth of fungus that can be treated with a topical antifungal. Pediculosis is the medical term for lice, a louse infection. And these are some pictures of adult lice in hair. So you can have lice. There are body lice and there are hair lice, and there are two different types, two different species. But hair lice are very, very common. They're very common in schools, and amongst kids, they can spread very quickly. Scabies are mites. These are like tiny, tiny, tiny little arachnids that can dig and burrow under your skin, and they eat dead skin cells, and they cause this itchy rash. Different allergic conditions. So this is an example of contact dermatitis. This is somebody's armpit. It's kind of hard to tell what part of the body it is. This is an armpit. So this would be somebody who had a bad reaction to a deodorant that they tried, and they ended up with inflammation, contact dermatitis. So it causes erythema, redness, and pruritus, itching. Another type of skin condition that's not allergic, I don't know why it's on this slide here, neoplasms. So neoplasms are different. They're new growths. It literally means new growth. So there's a lot of different benign neoplasms. So these are ones that are not cancerous. They're harmless. Things like, and as you grow older, at least this is my wisdom being passed on to you, as I've grown older, I've found more and more neoplasms. So you just start, you wake up one day and there's a new mole, or there's a new skin tag. So there's a lot of these growths that just happen as we age and are harmless. Actinic keratoses are from sun exposure. Freckles, also from sun exposure, are flat pigmented macules. Age spots, as you age, you get some more of these different types of pigmented macules. This is a hemangioma, and this is a fairly large one. This is a congenital hemangioma, and a lot of times the congenital hemangiomas go away, so it's just like exposed blood vessels. The more common types that you see sort of every day on different people's bodies are what are sometimes called strawberry spots, just like a small bright red, looks like a red freckle, and those are actually tiny hemangiomas, little swollen blood vessels, basically. And then a nevus is the medical term for a birthmark, and there's a whole family of different types of birthmarks, and I think the book gets into it, but I am not going to hold you accountable for those. Just know a nevus is a medical term for a birthmark. Some other types of benign growths or neoplasms. A papilloma is the medical term for a skin tag. They're often just referred to as skin tags, but papilloma is the medical term. They're not pictured here. They're just like little loose flaps of skin. A lipoma is a mass of fat. Lipo, fat, oma, mass or tumor. And these are not cancerous. They are underneath, they're in that subcutaneous tissue, where the adipose tissue basically forms like a knot or this mass, and you can sometimes see them or feel them through the skin. Sometimes they can become enmeshed in the muscle tissue a little bit, and then they can cause pain and might need to be removed, but a lot of times they're just, you might be able to see it, like it might form a little bit of a bump and be odd looking. But they are definitely not, they are very, very, very rarely ever cancerous. A xanthoma, xantho means yellow, and these are a type of kind of like a lipoma. They're made of cholesterol or fat that can collect in the hands of people who have high blood lipids, hyperlipidemia. You may see these types of nodules that are called xanthomas. Some other conditions affecting the hands and feet: syndactyly and polydactyly. So this has to do with the number of digits. Dactylo means fingers or toes, digits. So syn means together. Syndactyly is when you have toes or fingers that are fused together. So this is oftentimes the skin is fused together. Sometimes they can be separated surgically, if it's just a very superficial fusion, but sometimes they're more fused than just the skin level, and separation can be more challenging. Polydactyly is having many digits or extra digits. So if you have 6 fingers, like the 6-fingered man in Princess Bride. This is actually a slide These are pictures from a former student of mine. After I gave this lecture, she's like, oh, my nephew has syndactyly and polydactyly, and he's about to have surgery to have it fixed. And she gave me these pictures and said I could share them with the class. So you can see on his right hand here, he has 1, 2, 3, 4, 5, and then his thumb down here, 6 fingers. So there's an extra finger here, and these 3 are fused together. And the reason he was going to have surgery was because the doctors realized the way the bones were positioned in his hand, there was a lot of crowding, and it was going to affect the growth and function of those bones. And so it was better to take them out, give the other bones room to grow, and the muscles and everything. So he did have one of these fused, but probably this middle one right here, removed. There's also, of course, neoplasms can be cancerous or malignant. All right, so the common types of skin cancers are cancers that arise from either those basal cells, the lower basement membrane of the epidermis, or from the melanocytes, the melanomas, which can often be triggered by excessive sun exposure or getting burned too many times. And there's also squamous cell carcinoma. So there's different types of skin cancers based on the type of skin cell that the cancer arose from or originated from. I won't get into Kaposi's sarcoma. That's specific to AIDS patients, but it's a type of skin cancer as well. There are autoimmune diseases that affect the skin. Psoriasis is one. Psoriasis, not to be confused with cirrhosis, which is a liver disease. Psoriasis is like a plaque of dry, itchy skin, and it's not from dryness, it's actually from the immune system causing extra inflammation. And it's uncomfortable and it can be unsightly, and so the treatments for it tend to be immune suppressors, different types of immune suppressors. Scleroderma is also sort of similar to psoriasis, causes like a hardening, these itchy plaques of skin. And then systemic lupus erythematosus. This is really a systemic condition. It's not of the skin, but there are some manifestations in the skin. The most common manifestations, though, of lupus are fatigue and joint pain. But one of the classic signs of lupus is a reddening of the cheeks that you see, a sort of flushed rash on the cheeks in people with untreated lupus. So that's maybe why it's mentioned in this chapter. Some diseases affecting exocrine glands, so the sebaceous oil secreting glands. If you over-secrete oil, that can lead to an overgrowth of bacteria in the hair follicles or on the skin, which leads to acne. Acne vulgaris is the acne that we associate with like teenagehood. And so the hormones of adolescence combined with the excess sebum production result in bacterial infections that cause these different cysts and pustules and things to grow, often on the face where there's a lot of sebaceous gland production, but also the chest and the back are common areas. And then later in life, a different set of hormones coupled with excess sebum production can lead to rosacea, sort of a reddening of the cheeks and parts of the face. Conditions of the sweat glands. You can have conditions where there's not enough sweat or where there's too much sweat. So anhidrosis, an means without or away from. Hydro is a combining form for sweat. So it's a condition without sweat. So these are people who don't have functional sweat glands or have a severely reduced number of functional sweat glands, which sounds like a dream, right? Like, oh yeah, I'd love to never sweat. But sweating is a very adaptive response. It helps us cool down when we are overheating. And so people who have anhidrosis are actually in an increased risk of hyperthermia, of overheating, of fatal overheating. And so they oftentimes can't participate in strenuous activities. They can't live in hot places where their body temperature will go up and they need to sweat to cool down. I had a student once who said she had a friend whose kid had this condition, and they played soccer, but they had to have a water bottle, and they had to like squirt themselves constantly with this water bottle, so sort of like mimic sweating. So since their body couldn't sweat, they had to physically like spray themselves with water to get that evaporative cooling effect, which sounds like that would work. Um, Diaphoresis is excessive sweating. So there are some people who maybe just have excessive sweating normally, like they have a condition where their sweat glands are overactive, but that's more rare. Usually the term diaphoresis is used as like a symptom when somebody is in a lot of pain. A lot of times they will sweat excessively. So diaphoresis can often be charted as a symptom of something like a heart attack or a stomach bug or various different conditions that profuse sweating is a sign of. Some diseases now of the hair, of really the hair follicles. So alopecia is the medical term for hair loss, what we sometimes call male pattern hair loss. So hair loss from usually the head. Atrichia is a condition without hair. So it's not losing the hair, it's just not having it to begin with. So you can have congenital atrichia where you're born without hair. The hair follicles aren't functional and you don't grow hair. I've met 2 people in my life who had this condition. One was a man, and it was harder to tell with him because he was bald. And for men, that's like a very normal style choice for their hair. But if you looked at him more closely, you realized his face was hairless as well. He didn't have eyelashes or eyebrows. He didn't have hair on his arms or anything. He was very hairless. Another one was a female who you also couldn't tell because she wore a wig and she drew on eyelashes or eyebrows, and she had like fake eyelashes. So we have so many things, accessories, and I don't know, not makeup, but I don't know what you call things like fake eyelashes. There's a lot of things that make these conditions much less obvious, particularly as people get older and take care of themselves, versus like maybe when they're a child and they still may not wear a wig or something, and that might make them stick out more. Folliculitis is inflammation of a hair follicle. If you get razor burn is basically just folliculitis. It's the hairs that have been cut growing back in at an angle and causing inflammation of the hair follicle. Hirsutism. Hirsute means hairy. So hirsutism is a condition or disease of hairiness. So people who are just extra hairy, those guys that take off their shirts and look like they're still wearing a sweater because they've got a lot of hair on their chest and back. So hirsutism is usually androgen dependent. So it's due to excessive excessive testosterone production. And it can happen in males and females. Schizotrichia, I like this one, is actually a term that means split hair. So the split ends of hairs, there's actually a name for that, schizotrichia. Diseases of the nails, onychomycosis is a condition of fungus, a fungal infection of the nails. And this is usually more unsightly than it is actually like pathological. So, and fungal nail infections tend to be very difficult to treat. So the fungus usually gets under the nail, and so you have to treat it for a long time until it grows out. So onycho means nail. Unguo, we saw on a previous slide, means nail. There's 2 combining forms for nail. Myco means fungus, as opposed to myo, which means muscle. And paronychia is infection of the cuticle. Para means beside, so paronychia is an infection beside the nail. Some different medical procedures, lab procedures and medical procedures that can be done for these skin diseases to help diagnose and treat them. First, if you have something that looks like a skin infection, they would likely do a culture and sensitivity, which is called a CNS, where they swab and then they take a swab of the infection site and then they swab it onto a petri dish and grow it to see what bacteria are there, and then also to test it to see what antibiotics it is or isn't resistant to. So that's a CNS. And if you have like an abscess, like a swollen, like a really like big pussy spot of infection, it's hard to treat those pockets of infection with antibiotics because they're so dense. So they usually need to be cut open and drained. It's called an incision and drainage, or I&D procedure. If you have a growth that looks like it might be cancerous, they might take a snipping of it and send it to the lab to be looked at further to look for cancer cells, and that's called a biopsy. Anytime you take a live piece of tissue to look at it under a microscope, bio, living, and opsy is kind of like scope, optical kind of, to look at it. So biopsy, you're looking at a piece of living tissue. Some different types of removal processes. So if you have a wart, you might have it removed by cryosurgery, where they use liquid nitrogen and cold. Cryo means cold. You may have heard of like cryopreservation, where you store things in a very cold freezer. So cryosurgery is using very, very cold liquid nitrogen to basically give you a tiny little spot of intentional frostbite. So you're basically giving that wart frostbite so it will die and fall off. Curettage is another way that warts and skin tags and moles and things might be removed, where the dermatologist will give you a little numbing shot, and then they will just basically use like a razor blade to scrape off that skin lesion, but you won't feel it because it'll be numb. And then debridement, or debridement, but I just say debridement. It's not debridement, it's debridement, is removing dead skin tissue, particularly in the case of people who have burn wounds. And then some surgical procedures. If you are having a reshaping of the skin, it's called a dermatoplasty. So like any kind of like maybe tuck procedures would be dermatoplasty. Or like I have a friend from college who, right before she came to college, the winter before college, I guess, she had a skiing accident. She was a downhill ski racer. She had an accident where her ski blade actually cut her face like open. And so she had this big scar here. And so over the years, she had several dermatoplasty procedures to reduce the scarring and reshape the skin. Rhytidectomy. Rhytido means wrinkles. So this is the surgical removal of wrinkles. They don't actually cut the wrinkles out. What they do, like for your face to remove wrinkles, is they cut along the skin line here, the hairline. They remove some of the skin here, and then they just pull it all back and sew it all back at the edge here of the hairline. And so they've stretched the skin on the face. That's how they remove the wrinkles. Liposuction is a procedure to remove that subcutaneous adipose tissue. It's not the safest procedure, and it doesn't result in long-lasting weight loss, but it can reshape the body. Skin grafting, like in the case of a burn wound or a very large abrasion or something you might need to, or an ulcer, might have degraded the skin to a point that you need to add new skin. So an autograft is a graft from some other part of your body, where they take skin cells from another part of your body. An allograft would be from another person, like a donor. And a xenograft would be from another creature, like animal skin. They're more and more developing these synthetic skin grafts, where they can basically take cells from you and turn them in and basically grow more skin cells in a petri dish that they can then put on you. So synthetic skin grafts are often a form of autograft, where they can grow more of your cells and then put that on you. And then lastly, the drug categories. I talked about a numbing shot if they're going to do curettage and scrape off a lesion. So an anesthetic, an means without, estheso is sensation or feeling. So it's something that pertains to without feeling. So an anesthetic is something that helps numb you, makes you numb. Antibiotics would be given for various types of skin infections that you might take orally, or you might apply the antibiotics topically, like even if you just have a cut. If you've ever used Neosporin, that's a type of antibiotic. It's a topical antibiotic, so it prevents bacteria from growing. Antifungals would be given to treat fungal infections like ringworm or jock itch or athlete's foot. And antipruritics are anti-itching medications. So these are basically antihistamines and corticosteroids. So corticosteroids are used like hydrocortisone or cortisone cream, contain steroids which reduce inflammation, and you just wear it like a lotion, so it can be used to treat dermatitis. Or you could take an antihistamine if you're having an allergic reaction and you're having a lot of itching. That also has an antipruritic effect. And that's the end of chapter 7. I'll see you next for chapter 10.